Hi, I'm Lisa Hayden with Channel 6 Central Kentucky TV, Community Focus on Washington County. And we're delighted today to have with us Trina Cameron, a Washington Countian, who originates from the Burg.
That's right. That's right.
And who is a nurse with Hosparus Health.
That's correct. That's correct.
So, Trina, I'm glad you could be on today. And first of all, you are an RN, is that correct?
That's correct, yes.
And I don't know how, you just recently started to work with Hosparus?
I started Hosparus in August, the end of August of last year, so 2018.
Okay.
So about 9 months, 10 months, something like that.
Okay. And before that, I was thinking you were at Flagey?
I've been at Flagey since 2000, and I still do PRN occasionally with utilization review and discharge planning, so people that are discharging home from the hospital.
Okay. Okay. So in this new job now, I am totally unfamiliar.
Okay.
So you are going to have to tell me what Hosparus Health is.
Okay. So Hosparus Health, a lot of people have stigma about hospice and what that means. A lot of people think, you know, you go with hospice, that means it's end of life, you're giving up. But Hosparus has branched out and has, you know, listened to the needs of the community and the needs of the patients and what all that it entails to take care of those patients and people that have goals of staying home. And, you know, it just looks a lot different than what it does. What it did a long time ago. Healthcare changes rapidly, so we have to adjust our needs as the patient's needs and healthcare changes. So with Hosparus, we have different programs. We're very proud to have a lot of different programs and offer a lot of different options for people. We have palliative programs, and that means they're not actually end of life. They can still get curative care, they can still get treatment. We come in and there's different ways you can apply for that, and depends on your financial resources, you know, if there's a cost to that. But Hosparus, what we cover 5 counties here. We're Marion, Washington, Greene, Adair, and Taylor. That's what my office covers. Okay. So we are not for profit, so we do not turn away for inability to pay. So anybody that meets criteria for Hosparus services and want to use that benefit, it is a free, you know, it's free to them to use.
Wow.
We do bill Medicare, you know, and we do bill insurances, and we survive off of fundraising and donations, and then billing, you know, the insurances. So we do have
Medicaid. Do you?
Medicaid, yes. Medicaid covers.
Passport.
We cover, that's all.
Okay.
That's covered at 100%.
I see.
So depends on what the patient's goals are. You know, Hosparus is when you have an illness or you're diagnosed with an illness that we don't feel like is going to get better, the doctor doesn't feel like it's going to get better, you know, or they're having treatments and the treatments is just not progressing in a positive way, you know, Hosparus is an option so they can come in and take care of the patient's pain and symptom management at home. So it gives patients and families the ability to maintain control and comfort at home if that's what they are wanting and that's what their goal is. So we help provide the equipment and the nursing. We have physicians that will come to the house and see them at the house. We have social workers, chaplains, and certified nursing assistants that all come to the home.
Wow. So and that is just that is to help manage your care at home for that's end of life.
Through the duration of whatever time that they have left.
And how long could that be?
We, Medicare makes us, I think every 6 months we have to reevaluate, but we've had patients that have had Hosparus. Ray had it, I believe, 8 years. Now he was, a couple times he got to where he was doing so good. The nurses come in, they're looking at their medicines every week, they're looking at the patient every week, they're making calls to the doctors to make adjustments, and sometimes patients get better, so they don't meet criteria anymore for Hosparus, and so they're discharged and they can either go with home health if they want, and then if they ever need us again, you know, we can pick them back up as long as they meet eligibility. But
and what is that eligibility?
Eligibility is based, it's our medical director. We kind of gather the information for the patient, see how what they've been doing, what their goal is, and we look at all that and take all that into consideration, and then the medical director determines whether or not they meet medical eligibility. But if their disease process is getting progressively worse, their functioning of their abilities to do activities of daily living are decreasing, and their ability to function independently is decreasing, those are all factors. If a patient is getting treatments like chemo or radiation and those things are not working, a lot of times they'll have us come in and help treat them palliatively, so if we can maintain them at home until whatever time that they don't need our service.
You could be on hospice for a long time then.
Yes.
Was Ray on it 8 years?
I think on and off for 8 years. I don't think he discharged, but maybe a couple times. But he did. Mary Vivian always has said that if it wasn't for hospice, Ray, she don't know how she could have took care of Ray, and she did. She did it. She did her vows out through the entire time, and hospice was a big part of that. So
8 years, and of course Ray had MS.
Yes.
And he was had to be evaluated every 6 months. But now, and then of course if you get better, you would have to go off, but you could go back on again.
Yeah.
Okay.
Yeah.
So now that is for to make someone, I guess, comfortable. You don't expect them to get better, but you're saying that there are also, you're working now with people that's not necessarily end of life.
Well, maybe not necessarily end of life. That we have a lot of people that have a lot of comorbidities, a lot of different health issues. We have a heart program that we just implemented. We are checking their weights. We're measuring circumferences. We're keeping a close eye on how their disease process is changing, and we're trying to before it gets to a point where they're in distress. We're trying to, when the nurses go out, evaluate and assess and see how they're progressing, and if we're noticing that it's on the decline of their health, such as heart failure, increased in their swelling, increase in weight, having increase with shortness of air, we're able to look at all that and make changes and adjustment to their medications. So not only, do they feel better, they're living longer because we're treating them, for those symptoms and for those things. So it's making the quality of life better, for them. It's all about comfort and quality of life and dignity, and making sure that people's goals are at the top of our list. We prioritize that to whatever their goal is, to try to maintain that.
Now, they can be ambulatory. They can, do they have can they be out, or do they have to, say if you've got someone you're working with and someone wants to take them out to dinner on Saturday night?
Absolutely. If they feel like they want to go out to eat, we want them to live their best life.
Yeah.
Hospice isn't a hindrance to having a happy life. Hospice wants you to meet goals. If somebody has a goal of making, if it is something that's very terminal and they want to make it to see somebody's birthday in a couple weeks, hospice does whatever we can to make sure we allow that person to meet their goals. Whatever we can do and aid in that goal. We have patients that are full codes that are, a lot of people think you have to be a do not resuscitate in order to be, your hospice goals do have to, your goals do have to align with hospice care, but you do not necessarily have to be a do not resuscitate before you would meet criteria.
Yeah.
They just have to look at the big picture and see what all's going on for the patient.
Yeah.
We do Courageous Kids too, so we have children that are in hospice. Whether it's our Courageous Kids program, and they can also seek treatment. Kids can seek treatment. So if they do have cancer, they can still get those care. It's just supportive care for the families to keep them at home. Norton's is how far away, from us, an hour. But when you think of Green, Taylor, all those counties, it's a lot further for them and those families to drive to Norton's. And
right.
So
could it be someone who has, say, that someone that is like bedridden, that has maybe a quadriplegic or something, that not necessarily they're going, this isn't necessarily, they could live many years. Just,
right.
So it could be someone like that as well, correct?
That is correct. We do team meeting every 2 weeks on all of our patients. And what that looks like is everybody that's involved in their care gets together at Hosparus and they have a team meeting. That day, if we're the attending physician is always there. But say they have an attending physician, like they want to keep their local physician, and as long as they agree to be the attending, then that's fine. They can keep their local physician as long as they're in agreement. And then what we do is we have a team. We let them know, or we say what's happened, what's went on, if we changed any medications, have we adjusted their regimen in any way, and then we type it up and send it to them, so we keep that communication alive with the family physician, as well as, we do that together, because, the social worker might go out and find a problem that the nurse didn't know about because the patient didn't feel comfortable talking to. So, we could, make sure that their needs are getting met holistically through the diversity of a team. And then also, that's where the 6 months comes in too, because every 6 months we're evaluating to see if that patient is still meeting criteria for Hosparus.
I see. So now that team includes the doctor, the nurse, the social worker, the
chaplain,
the nurse aide, and what, like with a typical patient, what would your services include, say, in the span of a week?
Okay, so in a span of a week, usually, the nurse always goes out one time a week at least.
Okay.
But we're available 24 hours a day, 7 days a week. So we have customer support. We have a team of nurses in Louisville that if you call customer support, you're directed to the nurse. A lot of times it's something that they can call the doctor and manage over the phone and make adjustments that way. If it's something that the family really needs to have a nurse come out to see, for instance, if somebody is saying, he's not looking good today, he looks different, this is what's happened, this has changed, I really would like somebody to come out and evaluate him, then they'll send the nurse out and they can come. And a lot of times it's just reassurance for the family.
Right.
At end of life, there's so many things that happen that's out of our control, and the only thing that we can do is be there for them. And a lot of times families get so overwhelmed that extra support of just knowing you are doing everything that you can do, is just, it gives them the confidence to get through it.
Well, and educating them.
And education, yes.
Because, if you've never been in that situation and you're, have a child or a spouse or someone you're taking care of at home, like you say, it's overwhelming, and so many times you really don't, because if you've never experienced it before,
right,
just getting educated on the subject,
that's right,
is important.
It is. It is. And families, I've been on both ends of Hosparus now, and I can tell you that what you give to the family is nothing compared to what you get back for them being able to do what they need to do to keep this, to have their loved one at home and to meet those goals, and to see them, be in their recliner with their puppies or their grandchildren all around them, because that's what they wanted to have happen at the end of their life.
Right.
That is a beautiful thing. I have people ask me all the time, how do you do that? That's a hard job. It is a hard job, but when you see the miracle of childbirth, it's also a miracle at the end of life too. There's a lot of things that, you just take for granted, that it kind of gives you a humbling effect when you work in this field to see that. So it's been a great.
It takes a special person, Trina.
Well, maybe, but
it does. The kinds of people that work in that field. I just have met many people through the years who have provided that kind of care, And I just have to say, if they're doing their job right, they're a special person.
Well, we do have a wonderful team. We do. We do.
And so in the course of that week, then you might, you said that, you know, you'd have the nurse check in once a week.
You have a certified nursing assistant. They can come up to 3 times a week in the home. We also take care of people in the nursing home, but it looks a little different as far as nursing CNA services. Due to Medicare guidelines, they can go in there twice a week. So they can have their nursing facility aides twice a week, and then us twice a week as far as the nursing certified nursing assistant.
Oh, wow.
But the nurse can come weekly. The chaplain comes about every 4 to 6 weeks, and then the social worker comes every 4 to 6 weeks. Now, if we are there attending, the physician sees them about every 90 days. But they try, like when they're first admitted, to see them within the first 2 weeks.
Okay.
To kind of get a baseline on them.
Right. And so, if someone is interested, well, now let me go back 1 minute. Because if you know, you in the course of that week, now, what if they need someone to provide, you know, like bathing and dressing and things of that nature, or helping to feed, or, you know, do you all refer on that? Or because I know you all don't do that kind of service, really.
Well, we have. There's been occasion, you know, everything is individualized, like their plan of care. You know, the CNAs go out 3 times a week as a general rule, but if somebody's having just a bad day, you know, and needs help, you know, they'll send one of us out, whether we're an aide or not. You know, we're all nurses, and we all, you know, just because I'm not a CNA doesn't mean I don't do those things too, because that's part of patient care. So
the CNA does do that with patient care.
Yes.
What do they do?
They do bathing. They do bathing.
Oh, okay.
They do, you know, just anything that.
Once a week, twice a week?
Up to 3 times a week.
Oh, that's the one you, okay.
Yes,
3 times
up to 3 times a week. Yes.
Gotcha. Okay.
Yeah. And you know, whenever a lot of people at end of life, you know, they're not up and mobile and moving around like they once were, so they're less mobile, and you know, just lotioning legs and getting that circulation going, doing things, you know, making sure there's bed sores and things that, you know, they catch those things. You know, they're a lot of times the nurse's eyes. And, you know, they sometimes say, you know, you need to go see them again this week. You know, they're having a decline, you know. So we really depend a lot on them, too. They're very good asset to our team.
Okay,
so,
gotcha.
Yeah.
Okay, so that's good.
Yeah,
really good, yeah.
But if somebody wants somebody there 24 hours a day, 7 days a week, hospice does not do that, you know. But, you know, we're available if they need us. We're there for support, and if they need us, we'll make a visit.
Yeah. Okay. Okay. Well, and if someone's interested in this service, I mean, does your doctor refer you, or do people just refer themselves?
Well,
how does that work?
That's the funny thing. I got this little brochure because I brought this. I thought it was so good. Anybody can make a referral. You know, a lot of times I've had people, actually since I've started this job, know me, and they'll call me on my cell and say, "Hey, Trina, I think my dad needs hospice. Can you check him out?" And by all means. You know, if you can check them out, we can do it. So it just takes somebody calling, and anybody can make a call. You just simply have to call the number, and we can evaluate them. You know, obviously we'll get their name, you know, a few demographics, you know, just basic demographic things, but that's it. And then we come to the home. I go to the home. That's what I do. I go to people's homes, and
you do the evaluation.
I do the evaluation and get it all ready, and then my medical director, I tell them what I see. I tell them about all the medicines, and they say yes. You know, that's what I did right before I came here, and he met eligibility, and then I call and get them whatever they need. If they need a hospital bed, they need oxygen, there's certain equipment, you know, if they need certain equipment to help maintain them at home, we rent those for the patient. We cover supplies for the patient, gloves and incontinent briefs if they need those. So, you know, it kind of helps the family a lot. And then the medications that are related to their diagnosis, hospice covers that as well.
Oh, wow.
Yeah. So it's a lot, you know, people benefit a lot, you know, from hospice services, and it's an availability to everyone. It's just, I think Jennifer, our outreach manager, I think she said one time that only it's underutilized, you know, that hospice benefit. I think I think she's saying 64% of people do not use the hospice benefit that could.
Wow.
So,
well, gosh, I'm glad you're telling us all of this. The viewers on Channel 6 are going to be very interested in this, because it's certainly a wonderful service. I've known we've had, hospice, but I guess, are you just coming into Washington County, this hospice health? Is this new to Washington County?
It's not. It's actually been here for many years. It's just, the stigma behind hospice. People do not believe that, they think it's given up. And, due to healthcare changes and, we have adapted programs for end-of-life care. People that have several comorbidities can live a long life.
Yeah.
And that's okay with us. We want them to. We want to let them have the quality of life that they want as long as they can. And, a lot of people just don't know that. So that's why our average length of stay for hospice is 13 days. And that's really sad because people could utilize hospice a lot sooner and get that benefit.
Oh, yeah.
And have the service, all the, everything that comes with that service, the financial gains from it by, your medicines. A lot of people's medicines are astronomical.
Right.
So just having help with your medicines and help with supplies, equipment, oxygen, some people can't make it to the doctor and the doctor's coming to you.
Yeah.
So having those things there and they're not getting utilized, it's sad. But, I think the education is getting out there. It's a lot, people are a lot more open and seeing through experiences of other friends and family members that have had hospice. And I think that's what's causing the snowball effect here in this area. And because prior to a few years ago, there wasn't even a need to have an extra referral and admission nurse. That's why I got hired, is because I think it's getting out there. So
okay.
Yeah.
Well, that's good.
Yeah,
and
great.
It's good to have a local girl who's in charge of that, because that, when people know you and they, want to, like you say, they'll just call you up.
They do, and that's fine. That's fine.
Well, what is the number that they should call?
Yes,
not your personal cell necessarily.
Not necessarily, but they will get to me. Believe you me, they will get to me. It's 800-264-0521.
Okay.
So, or you can visit the hospice website, which is www.hospicehealth.org.
Okay. And you're in Hospice Health, okay, is the name of the agency.
Yes.
And so it covers Washington County and Marion, Greene,
Taylor, and Adair.
Okay,
Yeah.
so that's really good news.
Yeah.
Well, I'm just really glad that you have educated us, Trina,
Well,
on
thanks
this
for having
subject.
me. Yeah.
Yeah. So I look forward to seeing you, and not as a patient now necessarily.
Yes, that's right.
Thank you, but it's good to know in case, there's someone that I can mention that service to.
That's right.
Yeah. So, yeah. Well, good luck to you in this new position.
Yes, thank you.
You take care of yourself.
I will. Thank you. You too.